Hi guys. Hello. Hi. How you doing? Good morning. Happy Monday, March the 2nd. Happy Monday, March the 2nd. I know the beautiful New York sun is in my face. It's a beautiful early spring day. It's the first day of spring. So hello and good morning. Good morning to all my one subscriber who's listening right now. So go ahead and give me a thumbs up to my one subscriber today. Hello. This is LaQueen Terry Battle, Terry L. Battle, coming from upstate New York in the capital city, New York, Albany, New York, and over about 35 cities that I visited over the past year, 2 years, looking for work. And I'm happy to be here in the central New York area, here in the beautiful downtown Albany. Thank you again to the Albany Public Library, as well as to the Department of Health, the Department of Education, the American Public Libraries Association, and to senators, various senators, Parker, wonderful man who's actually able to help me out with his services, and his staff who's actually able to help me and give me some resources and assistance that I need here in the Albany area. So thank you again to Senator Parker for your help and your support and your staff, as well as to a young man who's also part of the legislative staff, who's also a consultant here. In Albany. His name is Jerome, and he's a great public speaker. Thank you again to the consultant here. I don't know his last name, but I will be sure to go ahead and give out his services and his business card. And he does a lot of community talks. He does consulting with the Capitol. He does a lot of community events, government relations, things like that here in the city. So he's actually able to help me get a place to sleep last night. It was okay, but thank you again to friends like that who are able to assist me in my time of need. And I do need many more friends like that as well, whether they're male or female, because I need to open up my eyes and open up my mind and my energy in order to get the services that I need, whether it's male, female, church, whatever religion you are. We're all the same. So I, again, thank you to a consultant, an Albany consultant here in the Albany capital area, Jerome. Thank you again. I will go ahead and guys send you out to the link to his services and his consulting firm as well. And he's having a community talk here in the Albany area tomorrow, Tuesday, March the 3rd. And he's going to be doing a public talk about what's going on in the community, as well as getting the resources needed for Super Tuesday as well. So I'm just going to go ahead and briefly introduce myself. My name is LaQueen Terry L. Battle, LaQueen Arlene Battle. I am a certified medical assistant phlebotomist. I'm certified in medical assisting, clinical medical assisting, not just medical assisting, but not medical administrative assisting, but I am certified as a clinical national certified medical assistant, national clinical medical assistant. So I do pretty much I do any kind of blood work. I do pain management, pain injections. I do physicals. I do immunizations, school physicals, gynecology work, any kind of referrals to specialists. I do anything clinic related as well as hospital related. So if anybody's in need, especially since I've been out of a job, I've been pretty much doing a lot of first aid work on the street. So helping with seizures, helping with first aid, helping with overdoses treatment, epilepsies, pretty much just being a community on the street, as well as from jumping to jumping, like a kangaroo jump from place to place. I've pretty much been on the street offering first aid, as well as good Samaritan assistance to those who are in need, especially the homeless population, and pretty much anybody in the community that needs help. Most of the time, the fire department knows I'm available. I'll go and visit the fire department every now and then, let them know, hey, I'm here. How you guys doing? If you need help, as well as the EMS, emergency medical services. I usually know that I'm in the area and that I'm able to offer assistance. Sometimes I show my CPR card, sometimes I don't. But usually people know me by my face. They know me by my character. I hope they know me by my character, but pretty much if anybody just needs any kind of medical help or any kind of general help in need, I myself, as just a regular person and also a medical profession, but as a person who also has been needing services too, am able to offer myself an assistance that is needed. So again, let you guys know that I am a national clinical medical assistant. So I do anything front office administrative related, as well as back office, anything clinical, exams, blood work, injections, physicals, immunizations, sutures, staples, anything like that, as assisted by a doctor. And it's a CMA, a clinical medical assistant, a certified medical assistant, is almost the same thing as an LPN, a licensed practical nurse, not an RN, but a licensed practical nurse, except New York State doesn't honor the two unless you get trained for. The training is different. The training is almost the same for a CMA and an LPN, but New York State, as well as other states, don't accept you as an LPN until you go to school, go through all the clinical work, clinical rotations, and actually take the NCLEX to become a licensed practical nurse, a licensed vocational nurse. So in order to become an LPN or an LVN, you need to take the NCLEX PN practical nursing course in order to be certified and registered as a nurse. So in order for a medical assistant to become a LPN or an LVN, they need to take the NCLEX. Now, a CNA, a nurse aide, a home health aide is not the same thing as a medical assistant. Okay. A CNA does bedside work. They do a lot of cleaning. They do a lot of dirty work. So pretty much if the doctor needs assistance, like most of the time when a CNA is involved in a medical setting or hospital setting, most of the time they're just doing updates to, they're doing updates to management. So the management team has already been in the course of action. The management, the doctor staff, the nursing staff, registered nursing staff, as well as the LPN staff has already done the treatment plan for the patient. But then when the CNA comes into order, that's when they do the cleanup, the dirty work. Like they just do the bedside manner. They check the patient, make sure that they're stable, make sure that the area is sanitized and clean, if they're okay, if they've taken their medicines. Sometimes the CNA does take diabetes readings. Sometimes they do take glucose readings. Sometimes they don't. But most of the time, a CNA, a nurse aide, is only an aide to a nurse. They're an aide to a nurse. So usually anything CNA related is their overhead, their staff, their supervisor is always going to be a registered nurse or an LPN. Now, when you're dealing with medical assistant staffs and LPNs and RNs and MDs, usually overhead or supervisor for a medical assistant most of the time a supervisor for a certified clinical medical assistant or a registered medical assistant, RMA or CMA. Most of the time their supervisor is primarily a medical doctor or a doctor of osteopathy, a DO or MD. Most of the time, a medical assistant supervisor is always going to be their direct supervisor. That link is always going to be an MD. Because an RN, usually if you have an RN and a CMA and an MD in the same office, most of the time that registered nurse is always doing administrative work and always doing extra referrals that are needed that the clinical staff is not able to do, but that RN registered nurse is doing other work, additional referrals, are getting permission for referrals, get permission for procedures from the doctor. So usually if an MD, an RN, and a medical assistant is in the same office side by side with each other, the medical assistant is doing all the clinical work, all the clinical procedures, and then the RN is pretty much running the office. So the medical assistant is doing all the procedures, all the clinical work, all the vitals, the physicals, all the dirty work like a CNA, but they're not the same thing as a CNA. So usually it's most of the time the CMA, the medical assistant, is doing the clinical work, the RN is doing the administrative work, and the medical doctor, the medical physician, is overseeing everything. So usually most of the time a medical doctor comes in to see a patient for about 2 to 3 minutes. That's it. So the medical doctor comes in to see the patient for about 2 to 3 minutes while the medical assistant, how you doing? The medical assistant informs the doctor of what's going on, what procedure is going to be done that day, the patient's vitals, their prior history, everything that is needed to inform the doctor of the exam, of the procedure, of the patient visit, give them a 2 to 3 minute heads up of what's going on with the patient. And then the doctor comes to see the patient for about 2 to 3 minutes, check on them, update them, and then the doctor's in and out of that office. So a medical assistant provides the work, does all the prep work as well as the clinical work that the doctor needs. So that's how it works. It works with the medical assistant doing all preparing the office, preparing the clinical room, preparing the patient's room, stocking everything just like a CNA does. but a CNA doesn't provide any kind of assistance to a medical doctor. A CNA, most of the time, they don't have any kind of direct communication with a medical director or a physician most of the time. Anything that a CNA is doing, in my opinion, is out. If they have any kind of direct communication with a physician, is out of their hands. The overhead with a CNA most of the time has to do with the registered nurse. And then that registered nurse has direct communication with the office manager or the medical director. So anything that a CNA does is mainly primarily related to the charge nurse, the registered nurse in charge of all the CNA staff. And then that registered nurse does communication with the clinical director or the MD in charge of the clinic. Now, with a medical assistant, a certified medical assistant, they primarily, when I was working for Advocate Christ Hospital, and when I was working in Houston, Texas, volunteering at Methodist Hospital, when I was working in Houston, Texas, the various clinics, various home health agencies, I was doing all the prep work, all the prep reports, all the vitals. I was prepping the patient for procedure. I was prepping the doctor for the patient's procedure, prepping it beforehand, and then prepping the doctor, letting the doctor know what was going to happen beforehand. He would come into the office, speak to the patient beforehand, like a 3 to 5 minute conversation, and then he would inform me of what procedures needed to be done. Then I, as the medical assistant in his stance, would come in and assist the doctor with procedures. Now, CNAs, they do not assist physicians with any kind of procedures. They do not. If a CNA assists with any kind of procedure, most of the time that is an extra specialization, an extra class that they have to take in order to get permission to assist in a clinical procedure. So say, for instance, if a CNA does any kind of medication management, they have to take a class to become a medication aide. A CNA can give any kind of patient any kind of prescribed medication. They have to take an additional class to get that certification to become a medication aide in order to get that along with their CNA license. And that's the difference between a medical assistant, well, in my opinion, a medical assistant and a certified nurse's aide, a certified medical assistant and a certified nurse's aide. Now, if a CNA does assist in any kind of medical, any kind of surgical procedures, they usually have to get the overhead primarily from their charge nurse, which is most of the time a registered nurse. They have to get the overhead from a registered nurse. They have to get the overhead from the top CNA on staff, and then the overhead from a registered nurse, and then that registered nurse has to get the overhead from a medical doctor. Now, if a medical assistant assists with procedures, that is part of their job duty. That is part of their duties of under their license. So they don't have to get permission from anybody. That is part of the protocol of being a medical assistant. You have to be there in order to assist a medical doctor or an advanced practical nurse, which is an APN, to assist with procedures. If an APN, a nurse practitioner, or an MD does not have any kind of clinical staff to assist them, then that is another duty, another issue when it comes to providing the best care, the quality care of patient management as possible. So, and being a medical assistant, and since I'm out of a job right now, if there's something on the street and anybody needs any kind of assistance on the street and there's no medical staff around, or if they see a registered nurse pass by on the street, and if somebody's on the street having a seizure, or if somebody's on the street having a heart attack, and you see a clinical personnel on the street in a badge and scrubs, and they have on their badge RN, or if they have on their badge CNA, or if they have on their badge MD or CMA, or any kind of medical certification on their personnel on them, and a person on the street is having a heart attack or an epileptic seizure or any kind of issue, then that person, that medical professional that walked by while that person was having a heart attack or a seizure could actually lose their license. Even off the job, they could actually lose their license because they are failing to follow, it's called under the creed, the doctor's creed or the nurse's creed, or the certified nurses creed. You always have a creed every time you get a medical certification. You can actually lose your job if someone reports you to the Department of Public Health for not following, not using your medical resources in order to help somebody you need. And most of the times, I've seen it plenty of times. I've seen it in Dallas, I've seen it in Chicago, I've seen it in Houston. Most of the time, RNs and MDs are very tired. They're worn out from their 8, 10, 12, 14, 16-hour shifts. They're worn out and they're tired, and they do not want to help anybody on the street. They just want to go home, get out, have a drink, and just relax. They don't want to do anything with medical. They don't want to do anything with first aid. They don't want to help anybody else. They want to do no more patients, no more blood, nothing. They just want to get a check and go home. They just want to get a check and go home. But you can't do that when you accept the job as a registered nurse, or when you accept the job as a medical physician. You cannot do that, because your job is your life. Your life is your job. And every single day of your life, if somebody needs help, you have to be there. It's part of the duties of having your license. If someone sees that you are refusing service to somebody because of you're not on duty, you're not on call, but you're refusing service to somebody, whether it's paid service or not paid service, you can actually lose your medical license over that. Some people and many doctors and nurses have been reported to the licensing bureaus and agencies because they are refusing service to people because they're off the clock. And you cannot do that. You cannot do that when you're off the clock and refuse service to somebody. You cannot do that. So it's actually a law that you actually have to provide services to people in need. But most of the time they don't want people to know, or what they do is they take their badge and they hide it underneath their clothing, underneath their scrubs, so that they can just walk on by and they hide their badges underneath their scrubs, because they don't have to deal with that responsibility. But somebody has to do it, whether you have CPR, first aid or not. And you also covered, a regular person on the street or a regular citizen is covered under the Good Samaritan Act to provide first aid and assistance. You are covered from any kind of liability, any kind of insurance issue, or if there's a problem with the death of a person on the streets, you are covered under the Good Samaritan law. And that's what's also important to deal with the coronavirus, because it has been such a media frenzy. It's like a frenzy. It's like, oh, it's the next Ebola. Oh, it's the next Black Death. Oh, it's the next Black Plague. And it's not. It's not the Black Plague. It's not the Black Death. It's not, any kind of issue to deal with rampant spreading infectious diseases, or any kind of exploding viral infection, viral disease for everybody. It's not a viral disease, contagious for everybody. No, that's why the director of the WHO just made a press conference today on Monday, March the 2nd, declaring that what they're really trying to do is work again on infection control and also work on containment, which is very important. And a lot of countries that are third world countries, or a lot of countries out there, especially China and India, where there are billions and billions of people living in a tight enclosed space. So when you're dealing with China, when you're dealing with the capital of China, one of the biggest cities, China is a country as well as it's a continent, but it's a country still. So when you're dealing with one of the capital cities in China, Beijing, and you have over 20, 30, 15, 20 million people living in just one city, there could be any kind of disease, medical disease, spread rapidly all of a sudden from 5 minutes to 30 minutes to 2 hours. And all of a sudden it can spread not just in Beijing, but it can spread into China, and then it can spread into India, then it can spread into Europe, and it can spread all over the world, because that tight knit close inbox of 20 million people in one box. And one of those 20 million people goes to this part, they take that with them. So when you have 20 million people living in a box, it's not just one person that goes out of the box, it's 10,000 people that go out of that box at the same time. So it's not just you're in your apartment building, it's not just you and your neighbor on the same floor, it's actually you and you have 100 neighbors on the same floor. And then on the lower floor above you, you have another 50, 100 people living on another floor. And then another floor above you, you have about 50, 100 more people living above you. And all in one apartment building, you have about 5,000 people living in one apartment building in Beijing, China, or in one apartment block. One apartment, a whole block of a community in Beijing, China, could be at least 5,000 people. So just one block, here's one block, and here's the street. Okay, I'm just trying to imagine how containment works. This is what Dr. The president, the president of the current president of the World Health Organization was talking about. His name is Dr. Tedres Adhanom Ghebreyesus. This is what he was talking about. It's called containment. It's called, what they're trying to do is they're trying to contain the disease. And actually, when you contain it, that means you prevent any more further spread of the illness. And then once you contain the illness, then that means you are able to provide some kind of sanitary infection control measures to prevent any further spread of the disease. So the main thing is, of course, infection control should be primarily important, but you also just want to contain the disease, and then from there you deal with infection control. So you want to contain it from spreading any further, but at the same time you have to do infection control inside, and you have to do infection control outside, and you have to do infection control inside. So this is what Dr. Tedres was talking about today at the about 2 hours ago on the press conference of the World Health Organization. This is a little bit what containment means, especially when you're in countries like, when people think of China and India, they think it's third world countries. Oh, Japan's a third world country. Oh, Africa is a poor, desolate continent. No, honey. Africa, China, India, they are not poor people that are living in these countries. They are rich people. They are rich people. They are millionaires. There are so many millionaires and billionaires. One person can be living in an apartment building in India right now, and he could be a billionaire. But on the same floor of the apartment building, right across his neighbor, right across from him, can also be a billionaire, and underneath him he could be a billionaire, because it's just, there's so many. The population is constantly growing and growing and growing in India, and growing and growing and growing in Asia, and as well as China. So people, they really can't contain. It's really hard to contain 1 billion people in India, and it's really hard to contain 2-3 billion people in the country of China. That's impossible to contain. 3 billion people in the country of China. It's impossible. So that's why all the National Institutes of Health, all the health organizations, the Center for Disease Control, the World Health Organizations, what they're really trying to do is they're trying to not only contain the disease, but contain the population of people that might be, not only have symptoms of the disease, have been tested positive for disease, but are also receptive carriers to disease as well. And people look at me and they think, oh, I'm part of the homeless community. I've been in shelters. I'm single, I'm Black, I'm not married, so I must be a carrier of disease. No, not necessarily. Not necessarily. How it works is that when you're in a large, not just a small closed inlet of people, it doesn't have to do with anything with being in a shelter or dirty or clean. Not necessarily is dirty or clean, but when you're in a large influence of people, in as well as China and India, just that large population of people, anything positive or a good virus or a bad virus can spread so very easily in from 30 seconds to 2 minutes and kill at least 10,000 people like that, just because of the influence of population growth in the country of China and in the country of India. Just because of the population itself. It doesn't have to mean if it's clean conditions or dirty conditions. It's just the population of people itself. So one person may have a clean apartment, may be a medical doctor, and on the 3rd floor, and then there might be a family of eight, 2 parents and 6 kids on the 2nd floor, and then all of a sudden, they're on the same apartment building. But one of the kids from that family gets sick and spreads it to the medical doctor, and that medical doctor has to go to the hospital and work at the hospital, and everybody that makes connection with that medical doctor gets infected by that doctor because he carried it from the family of 8 in his apartment building. So you can imagine a family of 8 to one doctor, from a doctor then going to a hospital, and in China, not in a regular, not in a regular, I mean, a regularly controlled population growth like, I mean, London does have cases of coronavirus, but I'm mainly thinking about like small countries, Germany, or countries in South America, countries like um, even in here in the United States, in Canada, because Canada does have that population growth where it's very secluded. So some parts of Canada, some parts of the provinces in Canada, the territories in Canada, are very, very much secluded from other parts of Canada. So when you're dealing with Prince Harry and where he lives in Canada, and when you're dealing with the Prime Minister Justin Trudeau and where he lives in Canada, they're completely separate places. So Prime Minister Trudeau may live on the opposite side of Canada, and then Prince Harry and his wife Meghan Markle may live on the opposite side of Canada, but they can't spread coronavirus by themselves. You know what I'm saying? Because Canada is so big and vast. It's such a big and vast continent. Because of the tree, it's just the climate as well as the people. They're so much spread out. The climate of Canada is spread out. But when you're dealing with countries like India and China, especially in the urban parts of China, people are so close knit together that anybody can catch anything like that. You can open up your apartment window and catch it like that because of the such influence of people tightly knit together. And so I'm pretty much, I was trying to make a good picture right here about what Dr. Tedres was talking about, containment, because the window's in my way. This is the only space I can get media time. Okay, so here's it. Okay, so this is what Dr. Tedres is talking in the World Health Organization. This is pretty much, I'm trying to make it really good. There we go. The light's in my way. Can you guys see it? Okay, that's better. Okay, so the light is in my way. There we go. Better. Okay, so now this is containment. I don't know if you guys can see it. Good, it's really good. Okay, so this is containment, really. Okay, so containment, especially in countries like India and China, or even Japan, any kind of, especially China, as well as the Middle East as well, because people are living so tightly knit together. And even in Europe, people are so tightly knit together. Even like Paris, especially Paris. Containment issue is a very hard factor because you're dealing with a close influence of people so tightly wound together. The apartment buildings and inspections, all that running rapid. And so this is just one area grid of Beijing, China, as well as to Mumbai, India. So the X can mean like one apartment building. Okay, so I don't know if you guys can see that because there we go. Okay, you guys can see me good. Okay, that's better. Okay. How you doing? So here is make a really good picture. Okay, can you see? The light is horrible. I'm trying to make it darker. I'm trying to really make a good description. Hi you guys. Hi guys, I'm gonna make a little comment here. How you doing? There we go. Okay, so we're dealing with large countries and large populations like China. Containment is a really hard issue to take notice of. Out here, because in the Black Death, when the Black Death spread to when the Black Death spread in the early history, I think it was the Middle Ages of England. everybody was working in the same land and living on the same land property. And so there wasn't not necessarily proper hand washing technique or proper infection control, but everybody was so mixed together. Everybody ate off the same food. Everybody ate the same cow, the same lamb, the same chickens. And so the Black Death primarily went from the food source, and then from the food source it went to the people. And that's why the Black Death killed so many people, because it affected their food source, and then the food source affected the people. And so now with this viral disease, with our coronavirus, COVID-19, is not necessarily the food source, but it's what's going on in the air. And countries like India and China as well, they have a very smog climate population. They have a smog issue, problems with pollution, everything like that as well. The babies. Okay, so here is containment. So it's very, very hard. Here's maybe like one block, okay, in China. So you see the grid lines right here. So here is one apartment building in Beijing. Okay, this is one apartment building, and it is at least 10 to 20 stories high. One apartment building in Mumbai, India, and one apartment building in Beijing, China. Is at least 10 to 20 stories high. Just one apartment, a regular apartment building in Beijing, China, and Tokyo, Japan, and Mumbai, India, is at the very least at least 10 to 15 to 20 to 25 stories high. And it's not like an average apartment building that we see here in the United States, where you see glass and beautiful ornaments and beautiful decorated exterior. No, it's actually a cemented building, brick upon brick, mortar upon mortar, of at least 10 to 15 to 20 to 30 stories high of people living on each story. So when you try to talk about containment issue, it could be Mumbai, India, it could be Beijing, China, it could be the Middle East with Afghanistan, Turkestan, even Israel and Palestine. That's why disease control is very, very, very running rapid. So you have one apartment building that is at least 10 to 15 stories high. And one person in an apartment building, on one floor of that apartment building, catches this virus called COVID-19 or coronavirus. Now, on one floor of this apartment building in Beijing, China, or Mumbai, India, just one floor has at least 50 to 100 people, of families, single families, workers, everybody working together, living in just one floor. Now, 100 people on one floor, of 100 people per floor, that's 100 people on one floor times 20 floors. So 100 times 20 is 2,000 people in just one apartment building in Beijing, China. So that's 2,000 people in one apartment building in Beijing, China. 2,000 people. And this is the square grid of that apartment building in Beijing, China. 2,000 people. So if one person on every floor of that apartment building catches this viral illness, then when they leave out for the day, they leave this building, then they go across the street to the store, to the bank, and they carry those same symptoms as well as to the bank. And that bank may have about 5 to 10 stories of workers working for that bank in Beijing or Mumbai. And then across here may be a school, a grammar school. And so this grammar school in Beijing or Tokyo or Mumbai has at least 10 stories. And about on each story is about 50 to 100 students on each story of this elementary grammar school in Beijing and Mumbai. And so you can imagine how hard of it is an issue to contain just one apartment building and all the businesses that surround this apartment building in cities like Mumbai, in cities like Tokyo, in cities like Beijing, in cities like Israel. Just imagine how hard of an issue the CDC and the WHO has, not just for this disease, coronavirus or COVID-19, but any disease in general, because it's so hard to contain contain the symptoms, the immediate symptoms of this illness. And as you've heard on the news and you've heard on TV and you've seen in the newspaper, people automatically drop dead when they have this issue. And it's not a seasonal flu. Yeah, it's not the seasonal flu, but at the same time, every single year, some kind of influenza virus comes around. And you have to think of containment. What is it going to hit first? Is it going to hit bigger cities, or is it going to hit smaller, large out communities, rural areas? Is it going to hit the urban areas first, or is it going to hit the rural areas first? It's going to hit the urban areas first. And it doesn't necessarily have to be Asia or India. It could be any kind of community around the world. Most of the time when there is an influence of a viral illness, it hits the urban areas, because the urban areas are the ones that are mostly populated. And then when it goes from the urban areas to the rural areas, usually most of the time, if a virus goes from the urban area to a rural area, that's when it affects the food source. And then that's also when it's another issue as well, when a virus affects your food source, because you can't survive. And that's what actually happened with the Black Death. And that's what actually happened with Ebola. Ebola started affecting the chickens in Africa, the chickens and the goats. And so people weren't able to actually survive for themselves due to Ebola. People weren't actually able to escape from the illness because of the containment issue, as well as trying to be able to survive. Because Ebola also affected the people, and it affected their food source. So what do you do if you can't eat and people are dropping dead around you? What are you supposed to eat? Bread. The bread is molded and spoiled. People are still eating molded and spoiled bread. That's what happened with the Black Death. People were eating molded and spoiled bread every single day in order to survive. They were eating milk from cows and goats that were also infected with the Black Death. They were eating spoiled milk. They were eating molded bread. So imagine how, of course, it's going to be easy to die if you're drinking spoiled milk and eating molded bread. And that's what happened with the Black Death. It was hard for people to actually be able to survive. And so when you're dealing with serious illness like this, like COVID-19 or coronavirus or the chicken flu or, any kind of viral infection, containment is an issue. And yes, you want to put people in it. It's okay in some instances to isolate people. Yes, I do understand it is very important to isolate people and to protect the public, the general public, from the infected public. I do completely understand it. Containment is another way to contain somebody, but that's not how you really contain a disease. You can't really contain a viral when you're talking about, you have a disease. A disease is, it could be a cellular disease, or it could be a respiratory disease, or it could be a heart disease. But when you talk about containing something that's viral, where people are actually breathing, exhaling in it, that is another issue when you talk about containment, because people think, we can isolate these people on a boat. We can isolate these people on a ship. We can section and quarter them away from the clean people, and everything will be okay. No, you can't do that. You can't leave people on a ship or a boat for about 6 weeks to 3 months to 6 months in a year, and the public will be okay from these infected people. You can't do that. You can't do that. That's not how you really, really contain a disease. To contain a disease is to prevent any further population viral growth of that disease. You can't really stop a disease from stopping people, because when it's viral, that means it's not spread from one person. It's spread all over. Anybody that breathes in that same air, those spores of that air, therefore become infected. So when you talk about any kind of spores, whether it's secretions from the mouth or the nose or the bodily fluids, spores, they could be in vents, they could be underneath the doorway. You have spores in the air, you have spores in the air vents, you got spores on the security camera, you can have spores on anything that you touch. Spores, any kind of virus spores that could be on your cell phone. So someone has the flu, the seasonal flu, and they sneeze on your phone, or they cough anywhere near your phone, and you open up your phone. Therefore, you wonder why you're sick 2 weeks later. Well, somebody coughed on your phone. And so you try to section somebody off and put them off in a hospital for 6 months because they sneezed on your phone. That's not how it works. It's very, very, very contagious. And COVID-19, especially in big populations, that's another issue. In big populations like China and Beijing and Mumbai, India, and the Middle East and Europe, that the European version of the viral infection is different from the American version. So the Tokyo and the Beijing and the Mumbai, India may get a stronger dose of this viral infection. That's why people are dropping dead in Mumbai, India. They may get a stronger influence of this viral disease. And then when it reaches all the way west to the United States, all the way west to Great Britain, we may only get about 10 to 15% of the strength of that viral infection. So, it's good to take vitamins, and, I have my regular medication that I take every day. I take my regular medication for anxiety. Let me get some medication here. Pardon me, guys. Okay, so it's good to take good vitamins. Vitamins like these by CVS here, calcium, magnesium, and zinc. It's good to take a vitamin every single day. Vitamins are good for you. Vitamins are very, very good for you to take every single day. It's great to take vitamins. Can't see because the air is in my way. It's great to take vitamins. Vitamins are great, but they're man-made gelatin supplements. As well as I take my regular anxiety medication, citalopram. I take citalopram, and I also take calcium. I take vitamin D, and I take iron. So I take other supplements as well. But these supplements right here, these medications, these are man-made medications. So these are medications made by a factory. Now, when you're dealing with illnesses like the coronavirus, any kind of viral illness, I'm just trying to break it down and explain it to you. Because people think, I could take an antibiotic. I was at the hospital a couple of weeks ago here in Albany, and I was like, I really want antibiotics. Please, can I get some antibiotics? I have back pain. I'm stressed. Can I please get some antibiotics? They're like, oh no, you're fine. Everything's fine. You'll get over this. We're not allowed to give you any antibiotics. I'm like, I need some antibiotics. Can I get some antibiotics? No, we're not allowed to give you antibiotics. But just imagine if you have the disease originated in Beijing, and Beijing has a population of over 20 to 30 million people. So all of those, about 50% of the population gets positively tested for coronavirus. Okay, so this represents Beijing, China. Here is one whole tablet. Okay, so this is one whole tablet of Beijing, China. So Beijing, China gets the whole percentage of people that are affected with coronavirus, and Beijing get 100% of the worst symptoms of coronavirus. See, you get a regular tablet. I'm just trying to explain, because Americans, they think, I'm going to die, dead, fall down the street. No, that's not how it works, because it spreads from east to west. And if something spreads from east to west, that means in the west and the east is the strongest version of the illness, and in the west it's only a strain of it. And that's how people are like, I don't want to take the flu shot every year because I'll get sick. No, you won't get sick. It's actually it develops antibodies in your system to prevent you from getting any further worse complications than a regular seasonal flu would. Okay, so in Beijing, China, this represents Beijing, China, which has over 20 million people in Beijing, China, or Tokyo, Japan. I'm just giving it a regular description. I don't know how many people are in Beijing, China, but Tokyo, Japan has about 10, 15 million people. Okay, so in Beijing or Tokyo, this represents the strongest version of the coronavirus. So this is one whole. This is one whole of the virus. Okay, so when the virus moves from east, from Beijing, China, then it goes further west to Mumbai, India. Therefore, the virus, this one whole virus, becomes 50%. So I'm gonna break up this. Pill. Let's break it up. Make this. Make you guys easier to understand this. So in Mumbai, India, if you can see, I kind of cut it in half. There we go. So Beijing, China has all of the worst symptoms of the coronavirus. People are dropping in the streets, people respiratory problems, and 3 to 5 days, they're vomiting, they're emitting this, the smell of it smells like death. That's the worst symptoms. And that the people in Beijing and Tokyo get the worst of the symptoms. Okay, that's east. That's all the way east. Then when the disease spreads and somebody from Beijing, China goes to Mumbai, India further west, therefore they don't come with the full symptoms of the disease. They only come with about 50% of the disease. Okay, so let me there we go. So somebody in Mumbai, India has only about 50% of the worst symptoms of the coronavirus. So that person, if they get infected with coronavirus in Mumbai, India, even though it was in the east, it spread west, they only get about 50% of the worst symptoms, the worst onset of the symptoms of the coronavirus. And this is with any kind of disease, any kind of disease. So people in the east get the worst of the symptoms. People in the west get about 50% of the worst of the symptoms. And then the disease moves further west to Great Britain and Paris. Hi.
Do you want a study room?
I don't know if they're full.
No, they're not.
Okay, give me a minute. So people in Paris and London get about 25% of the illness. And so people, they get about 25% of the worst symptoms of the illness. So if the illness, they have a hard cough, they still have respiratory problems, they still have problems breathing, but they're not dropping dead like they were in Mumbai, India, or they're not having problems breathing, or they're not dropping dead within 3 to 5 business days like they were in Beijing, China, or Tokyo, Japan. And see how that the worst strain is in right here in Tokyo, Japan, and Beijing. And then the strain becomes less in Mumbai, India, and then the strain even becomes weaker in Great Britain. And then when people come from Great Britain and Paris and Germany, and they come to the United States, then that strain becomes weaker. That's why any kind of administration in office, whether it's Trump, whether it's Obama, whether it's Bush, whoever's in office, they have to actually monitor where travelers are coming from, because wherever travelers are coming from is where the strain is the strongest. And so we don't want somebody necessarily, it's not having to do with anything about prejudice or we hate people or whatever. We just have to figure out where the strain of the disease is the strongest so that we can prevent the public from having any worst symptoms. So we don't want to have a population with a less strain of the disease and a couple people. You can't just have one person from China coming to the United States. And China is 2 billion people, 5 billion people from China, and one person comes to the United States. That's not how it works. You can't monitor one person from China. That's impossible. You can't do that. Usually when people are coming from Beijing, China into any kind of U.S. Airport, port of authority, airport or transportation port, they're coming in by the hundreds and thousands. And so it is impossible to monitor how many people, because people travel all around the world, especially China and India have billions of people all around the world, always moving. So it is impossible to imagine how many people are coming in from China and from India and from Tokyo every single day into the United States. It's impossible to monitor them and put people on the list in the United States. It's impossible. It's impossible because the population of the United States is 250 million. And the population of China is 2-3 billion. The population of India is 1.5 billion people. So it's impossible to put people on a list as they come into the United States every day. When people are coming to the United States from India, they're coming at least about 500, 1,000, 2,000 Indians a day. People coming from China into the United States, they're coming in by thousands, 10,000s. It's impossible. You can't do that. You can't do that. You can't, and everybody doesn't look the same in India and China. They don't look the same. And there's different versions. So we were dealing with the strain. We had to figure out where the strain is the weakest, protect the public from from any kind of further strength of that strain, okay, and any further kind of diversification of that strain, and we're trying to weaken that strain as much as we can, and then when we weaken the strain, therefore we can develop a vaccine. And one vaccine won't apply to the whole population. One vaccine will also just apply to that one particular population in a region. Because that one vaccine deals with one strain, and another vaccine deals with another strain, and another vaccine deals with another strain. And then you have one vaccine, especially for China. If you give a person a vaccine that's meant for China, in the United States, it can kill them. But if you give somebody a vaccine that's meant for India, and you give it to, it's meant for the United States, and you give it to them in India, that won't help them at all. And that's how the seasonal flu vaccine works. And that's why all these health organizations are trying to develop some kind of method in order to contain this illness. And yes, infection control is common sense. It's common sense. Wash your hands, clean up after yourself, clean up after you go to the restroom. That is a very, very, very important issue. It's just common sense. That's how the Black Death happened. People were dropping like flies. Ebola, people were dropping like flies. And those low-income, diversified people dealing with Ebola, they really couldn't contain. They really didn't know what how to deal and how to properly sanitize, and properly dispose of a dead body. In my opinion, when people are dropping there's dead bodies in foreign countries, most of the time they bury them, or they burn them. They burn dead bodies. And that's what happened with the Black Death. They were burning stacks and stacks of dead bodies, as well as in World War II, they were burning stacks and stacks of dead bodies. But when you burn dead bodies, then the secretions from those dead bodies gets into the air, and it makes it even worse. That's another issue that happened with the Ebola. You couldn't just burn dead bodies and the illness wouldn't go away. You actually had to take the corpses, take the dead bodies, and put them into a secluded area to make sure that the further population, the further public, had no kind of connection, no kind of contact with these dead infected bodies. Because even though they're dead, of course, they still have secretions over their bodies. They're still emitting urine. They're still emitting secretions. There's still tear ducts coming from dead corpse bodies. There's still blood. There's still blood in a corpse. There's still blood in the corpse. So it's very hard to deal with disposing of properly dead bodies when you're dealing with a viral illness like coronavirus. So when you have a prime minister or a legislator that is infected with this viral illness, and he's in Italy, now Italy is primarily still Western part of the world. It's not Eastern, it's Western. And so Italy is right there smack in the middle. So the strain of virus that this legislator in India has, or the Middle East has, is probably mid between strongest and weakest. So he's right there in the middle. So that legislator may have 50% of the strongest symptoms of the illness from Beijing, or he may have about 50% of the strain of the illness from London. And so the people that are working with this legislator that has been tested positive for the coronavirus, they have to deal with what kind of strain does he have, and how do we best deal with those symptoms? How do we best deal with the symptoms that these has, as well as to properly sanitize every single area that he comes in contact with, because it gets even harder and harder to sanitize and to properly sanitize and clean an area when there is virus going wrong. Because when it's viral, it can go on your telephone, electronic devices, it can go on computer devices, it can go into cigarettes, the cigarette smoke, it can become viral through cigarette smoke. It can become viral. You can carry a viral illness on a pen. You can carry a viral illness on a pen. You can carry a viral illness on a piece of paper. You can have spores on a piece of paper. You could have spores on on a telephone. You could have spores on a cigarette lighter. You could have spores on a pen, and then you can even have spores on money. You can even carry viral spores on money. On money. I don't want you illness, but you can actually give somebody the seasonal flu by giving them change. So that's when it becomes worse. And people are like, oh, I'm paranoid, I'm gonna drop dead. No, you're not gonna drop dead. You may develop only a strain of the symptoms. So that's why it's just common sense, common sense. You got to have proper hand washing technique. You got to have proper sanitation technique for when you're urine or when you're defecating, clean up the area as well as wash your hair. Don't share combs, don't share brushes. Any kind of jewelry you have, make sure that they're clean. Any kind of jewelry, if you have rings on your fingers, make sure that they're clean. Make sure your clothes are laundried and fresh, everywhere you go. If you're in an area like Beijing, China, or Mumbai, India, where the strain is the strongest, it's not necessarily have to do with if somebody's Chinese or if they're Indian. It's just necessarily if you are in that location where the strain is the strongest, of course you would wear a mask. It makes no sense. Of course you would wear a mask. If everyone on the street is wearing a mask, you wear a mask too. And it doesn't have anything to do with that person's Chinese, that person's India, that person's Indian, that person's Pakistani, that person's Italian, that person's British, that person's an immigrant. It doesn't have anything to do with that. It just means if in that particular location of the world, that means that strain of the infection is the strongest in that location of the world. And so where in that location of the world, if everybody on the street is wearing a mask, of course, and you're visiting that country, of course, please put on a mask. If you're visiting that country, everybody's wearing gloves and a mask and a coat, of course, please wear masks and gloves and a coat. It makes common sense. If you are in Tokyo, Japan, and everybody's wearing a mask and eyeglasses, and you're in Tokyo, Japan, and you're American in Tokyo, Japan, or if you're American in Mumbai, India, and everybody's wearing glasses and a mask and a coat, wear American in Mumbai, India, please wear glasses, a mask, and a coat. It's common sense. It's common sense, as well as to sanitize your hands everywhere you go. It's common sense. If everybody's doing it, please do the same. It's common sense. It just makes perfect common sense, especially when you're visiting countries. Because, of course, if you're visiting countries and the people in that country know how to survive through this illness, they've been through this before, and they know how to survive it through it again, and you're a visitor in their country, in their foreign land, and you've never been exposed to this, but people in their foreign land have been exposed to this every single year, every single 6 months. They know what to do about it, but you're an American and you're visiting in their land and you don't know what to do about it. Of course, you're going to get sick and get the worst of their illnesses. Of course, because they are domestically have built up antibodies to protect them from this seasonal or influence of diseases. Because they have to deal with the population, the large population of people in their country. They have to deal with the strains of illnesses that come out every single year. They deal with this every single year because they live in their country and they're exposed to this in their country. And it's normal for them in their country. But here in the United States, it's not normal. And so in China, you may think, it's a great issue. We never had this before in China. Yes, it is a big issue. It is a big issue. The bird flu, the swine flu was a big issue in China, and it should be a big issue in the United States as well, because we get all their imports and their exports, food, linen, clothing, any kind of products from these countries. We deal with them with a trade. So the people in these countries have to protect themselves as well and have to deal with this new disease or new viral whatever. And so anything we're doing with viral, any kind of product that this country has or any kind of illness that this country has, they go to work and they develop an American product. Their virus can get on an American product and it can be shipped to the United States. So that's another issue. It's just primarily common sense. It's common sense. Sanitize, wash your hands, clean up yourself after you defecate. Protect yourself. If everybody on the street is doing it, if you see people in public, they're wearing masks. If everybody in public on the street, if you see more than 50 people on the street wearing a mask, wear a mask. If you see a person across the street and you see a person in front of you and you see a person behind you and you see a person to the left of you wearing a mask, please go to a store and buy a mask. It's just common sense. If you're American and you're visiting a foreign country for any kind of medical conference or medical procedure, please follow precautions and please take the precautions necessary to protect yourself and follow what that nation's protocol is for dealing with this issue. Just because you're a medical doctor, it doesn't mean that you will not be able to have any kind of barrier from getting this disease. That's not what it means at all. You are just susceptible to the disease as anybody else, especially when it's viral. So this is LaQueen, Terry LaQueen Battle. I'm gonna go ahead. I know we're about 1 hour. All my videos are 1 hour, it's so long. So I'm going to go ahead and play a snippet of the president of the World Health Organization, his conference today on March the 2nd, Monday, March the 2nd, about dealing with each and every single country that has been a carrier and has the symptoms of the coronavirus and dealing with what he's going through. So this is the president. I'm going to play an audio part of this. Of this conference that the president of the World Health Organization did today in his press conference. Okay, so let me find this right here. I'm going to play an audio, about 2 to 3 minute audio of this conference, okay? All right, so here you go, guys.
Good afternoon, everyone. Thank you very much for joining us today for our regular briefing regarding COVID-19. We have Dr. Tedres, WHO General, and Mike Ryan, Executive Director of the WHO MRC Program, and our technical lead, Dr. Maria Lang. For journalists dialing in by phone, it's *9 to get in line for questions. Those who are joining us via Zoom, it's clicking on raise
This is Dr. Tedres Adhanom Ghebreyesus.
Today with our media advisory, few links to documents issued by our regional offices regarding COVID-19. So we invite you to
just
read
listen.
Following this press briefing, we will have an audio file and the transcript the next day. I give the floor immediately to Dr. Tedres.
Thank you, Tariq. And good afternoon to everyone online and in the room. And hope you had a good weekend. The number of cases in China continues to decline. And yesterday, China reported 206 cases of COVID-19 to WHO. The loss since 22nd January. Only 8 cases were reported outside Hubei province yesterday. Outside China, a total of 8,739 cases of COVID-19 have been reported to WHO from 61 countries, with 127 deaths. In the last 24 hours, there were almost 9 times more cases reported outside China than inside China. The epidemics in the Republic of Korea, Italy, Iran, and Japan are our greatest concern. I would also like to inform you that a WHO team have arrived in Iran this afternoon to deliver supplies and support the government in the response. I would like to use this opportunity to thank Crown Prince Sheikh Mohammed bin Zayed Al Nahyan of the United Arab Emirates for his support in making this mission possible. Shukran Jazilan, Crown Prince. A WHO staff member in our Iran country, of course, has now tested positive for COVID-19, and he has mild disease. The Republic of Korea has now reported more than 4,200 cases and 22 deaths, meaning it has more than half of all cases outside China. However, the cases in the Republic of Korea appear to be coming mostly from suspected cases from the 5 known clusters rather than the community. That's important because it indicates that surveillance measures are working and Korea's epidemic can still be contained. Knowing and understanding your epidemic is the first step to defeating it. Korea's situation also underlines that this is a unique virus with unique features. This virus is not influenza. We are in uncharted territory. We have never seen before a respiratory pathogen that's capable of community transmission, but at the same time, which can also be contained with the right measures. If this was an influenza epidemic, we would have expected to see widespread community transmission across the globe by now, and efforts to slow it down or contain it would not be feasible. But containment of COVID-19 is feasible and must remain the top priority for all countries. With early aggressive measures, countries can stop transmission and save lives. We appreciate that people are debating whether this is a pandemic or not. We're monitoring the situation every moment of every day and analyzing the data. I have said it before and I will say it again. WHO will not hesitate to describe this as a pandemic if that's what the evidence suggests. But we need to see this in perspective. Of the 88,913 cases reported globally so far, 90% are in China, mostly in one province. Of the 8,739 cases reported outside China, 81% are from 4 countries. Of the other 57 affected countries, 38 have reported 10 cases or less. 19 have reported only 1 case, and a good number of cases have already contained the virus and have not reported in the last 2 weeks. We know people are afraid. We know they have many concerns and questions. Is the virus spreading in my community? Will my kids be okay? Will my parents be okay? Is it safe to hold an event? Should I travel? The answers to these questions will vary depending on where you live, how old you are, and how healthy you are. Individuals, families, and communities should follow the advice provided by local health authorities and local health professionals. WHO will continue to provide evidence-based guidance to help countries and individuals to assess and manage their risk and make decisions. There is no one-size-fits-all approach. Different countries are in different scenarios. More than 130 countries have not detected any cases yet. Some just received their first cases yesterday. Some have clusters of cases with transmission between family members and other close contacts. Some have rapidly expanding epidemics with signs of community transmission. And some have declining epidemics and have not reported a case for more than 2 cases, 2 weeks. I will repeat this, and some have declining epidemics and have not reported a case for more than 2 weeks. Some countries have more than one of these scenarios at the same time. For example, China had community transmission in Wuhan, but relatively small numbers of cases in other provinces. Other countries have a similar pattern. WHO is advising countries on actions they can take for each of the 3 6 scenarios. First case, first cluster, first evidence of community transmission. The basic actions in each scenario are the same, but the emphasis changes depending on which scenario a country is in. Our message to all countries is, this is not one-way street. We can push this virus back. Your actions now will determine the course of the outbreak in your country. There is no choice but act now. I thank you.
Okay, so that was
Tedres, we will start first.
today's live press conference by the president of the World Health Organization. So he pretty much wanted the international community, health community, the general public, to primarily focus on what your local health authorities say, as well as to focus on what is going on in your community. So if the symptoms are prevalent in your community, you should be alarmed, and you should take proper sanitation manners, infection control, as well as go to the doctor and hospital, and of course get checked. So if the symptoms are going around in your local neighborhood, province, or community, go to the hospital and get checked. But if you have, say for instance, your next door neighbor is an immigrant and they are from Greece, or they are from Pakistan, or they are from China, or they're from Tokyo, or they're from Korea, and they've been in the United States all their lives, and they haven't been to see their family in Beijing in over 20 years, they don't have the coronavirus. So you really shouldn't worry about your next door neighbor. You should worry about what is going on in your community, your neighborhood, your city. And if it's being noticed in your neighborhood, and you, like I said before, if you see people on the street wearing masks and sunglasses and a coat, you wear a mask and sunglasses and a coat. If everybody, when you walk down the street, everybody is wearing ear protection, eye goggles, a mask, and a long coat with sleeves, you see over 50 people on the street when you're walking down the street on your way to work, back from work, going to a grocery store, going to your car in your neighborhood. You see everybody in your neighborhood, in your suburb community, in your apartment building, in your apartment parking lot, in your job parking lot, in the parking lot, in the neighborhood, at a game, at a football game, and everybody is wearing glasses, a mask, a long coat with sleeves and gloves. Of course, you wear glasses, a mask, long sleeves, and a coat, and of course gloves. It's just common sense. And you should also, as well as primarily, please wash your hands and clean up after you pass any kind of stool or urine. It's common sense. It's pretty much common sense. And that's why the president of the World Health Organization primarily wanted people to focus on was pay attention to what is going on in your community and stop having so much bias or prejudice or chaos about it's going in the world, so it's going to come here. That's necessarily what's going on. You have to pay attention to what's on in your community first. And if somebody in your family is in that area, part of the world, make sure they're okay, but don't all of a sudden go visit them all of a sudden. Try to make sure have some kind of internal or commuter or kind of internet communication with your family, web communication with your family over the web, over the internet, over phone, rather than go across 5,000 miles to visit them in another country. If they're in another country, in another part of the world, make some kind of web teleconference, send them money, make a phone call, do a phone chat, something kind of that, because you don't want what's happening in that strongest part of the world to come to you here in the United States. And here in the United States, you bring that strongest strain of the illness, and you bring it to the United States. So now in the United States, people that have 5% of the strain now are exposed to 80% of the strain. And that's where it becomes worse, and it multiplies and it multiplies and it multiplies. And therefore, a vaccine cannot even be started because the strains get stronger and stronger every single day, every single minute. So you have to, that's why he's talking about containment. is very, very important when you're dealing with disease, especially viral diseases like this. Containment, containment, containment. And containment does not mean isolating people. It just means paying attention to what's going on into your neighborhood. If it's affecting your local neighborhood, if it's affecting your job, try to contain yourself, isolate yourself in that one part of the area. Go to work, go back to school, go to work, but go back to school. Give it at least 3 to 5 days. If nothing's changed, you're good to go back to your regular schedule. You're good to go back to your regular schedule. But keep that same schedule so that you won't spread any kind of other viral illnesses. Keep that same schedule. Don't do anything strange. Keep that same schedule. That's what containment is about. You want to contain anything that's viral. You want to have a set schedule. You want to contain it. You want to contain it so you won't expose yourself to any other further people or any other further strains of the illness. But you also want to contain it. And you also want to not protect other people as well as protect yourself. So have a set schedule. Know where you're going, know where you're going to. As well as if everybody on the street is wearing glasses, a mask, gloves, and a long coat, of course you would wear glasses, gloves, a long coat. And this is pretty much common sense. It's common sense. So containment, containment, containment. Have a set schedule of where you're going to. Have a schedule. Infection control. Wash your hands. Clean up any kind of bodily fluids from your nose, from your mouth. Cover your mouth when you cough. Cover your mouth when you sneeze, as well as it's common sense, as well as to have a set schedule for yourself, your partner, your mate, as well as your children. Have a set schedule because you don't want to expose the public as well as expose yourself and your family to any other kind of viral illnesses. That's what viral is. Viral, it gets rapidly out of control because you're dealing with spores. You're dealing with fluids. It's not necessarily diseases from animals. It's bodily fluids from humans. It's fluids. It's fluids. So that's what containment is about. Containment is about. It's having a set schedule, protecting yourself, infection control. It's pretty much common sense. Common sense. All right, so this is Terry LaQueen from upstate New York, the central New York, the capital city region here in Albany, New York, the capital of New York State. Thank you. Shout out to all my family, as well as all to my military family and friends. My little brother currently serving in the United States Marine Corps. Hoorah. Lakeem Jemiah Harris is currently serving in the United States Marine Corps. I love you, little brother. Pray for your safety and return, as well as to my friend from grammar school, Charleston Burke, who's also currently served in the United States Marine Corps, as well as to my Aunt Darlene Mercer, who served in the United States Army, my uncle Manzi Clay, who served in the United States Navy and National Guard, and his kids that are currently serving in the United States Navy and outside of San Diego, as well as to all my friends, my other high school friend from high school, Eastern Hills High School, Mary Johnson, who is a first and second lieutenant in the United States Army. Hoorah, you go girl, Mary. And also to my former Army Reserves unit outside of Sequoia, Texas, and Little Rock, Arkansas, 94th General Hospital, 94th General Compact Medical Hospital. Shout out to all my former Army reservists here in the United States, Texas, in America, here domestically as well as abroad. So I love all my Army family, Marine family, Navy, Air Force, also to my sweetheart Craig, Eddie wife, and his wife, Brianna White, who Craig, they call him Buddy or Eddie. Who just retired after 20 years service in the United States Air Force. So shout out to you, Eddie. A shout out to you and your family as well. So I love you guys. As a queen from upstate New York in the capital city region here in Albany, New York, the capital of New York State. And usually what happens here in New York State happens all around the world. I love you guys. Peace and love, much blessings. Shalom, salam, peace and blessings to you. Gracias por todo. Bendiciones para toda familia, as well as happy Lent season to the Catholic faith and to those who are Christians here and abroad and around the world, as well as a happy Ramadan to the Muslims who are serving as well here and abroad and around the world. So I love you guys. Peace and much love. Aloha. Love you guys. Bye.